Hi, a very good morning and a very good afternoon to all of you out there. First and foremost, I would want to thank each and every one of you for really taking time out of your schedules and being a part of this webinar. I can assure you one thing, guys. If you are looking for a career or looking to move around to the Middle East and in particular Saudi Arabia, by the time you leave out of this webinar, there will be definitely some information that would really help you in your career prospects in this region. So before I get to the topic about cultural sensitivity in healthcare, I would like to introduce myself to you. I'm Asif Iqbal. I have lived a major chunk of my life in the GCC and have worked with Aster hospitals in Oman for almost 11 years, in Bahrain with Kim's Health for 2 years. And recently, I just moved to Jeddah with Abeer Medical Group and in the capacity of an operations manager, and I head one of their hospitals in Jeddah. So that's all about me. Now, coming back to the topic, see, we all must have had relatives or some uncle or aunt or maybe other parents or someone who used to work in the healthcare industry, right? My mom was a nurse in Oman, and I still remember, like as a kid, when I used to go to her friend's house and everything, I used to overhear the conversations. As usual, we kids are always inquisitive. So I remember sitting and listening to them, and they just always talk about their work. It's general, right? So I remember, like my auntie used to be like telling her, my mom, and all, like, oh, that patient was so difficult. She was refusing to take out her abaya, or she wanted her husband to be with her. So many kind of complaints about that patient was being so stubborn with her beliefs or whatever it is. And at that point of time, it seemed quite normal. But with the changing face of healthcare currently, a patient's care, a patient's mental well-being is something that has been given a lot of importance. See, that was a culture that was followed in the Western region previously, but Western regions, they used to really give a lot of importance, and they still do, for the patient's mental well-being. So it's not only about treating a patient, it's more about making sure that the patient is comfortable by being treated by you. So that was something that was never followed in the Asian subcontinent part, like the Middle East or even the Indian subcontinent. It was like, he's come for a fever, just treat him for the fever and go off. He has got an ruptured appendix, do an appendectomy and just leave him. That's it. There was no importance given to making sure that he is, comfortable. Whether he has understood what is happening with him, why is he behaving in this manner. That was never given any priority. So that is something that, with the current changing trends in the GCC as well as in India as well, that is given a lot of importance. Patients' well-being, patients' emotional well-being is given a lot of importance. So knowing how to be emotionally connected to your patients, being culturally connected to them, is something that is going to be of priority in any kind of jobs that if you're looking forward in healthcare society, especially out of India, be it the Middle East or be it the Western countries as well. So now let's moving on to Saudi Arabia. See, as I told, like whatever I'm going to talk about is mostly going to be a huge part about the GCC, because the culture of the GCC is almost the same. But Saudi Arabia in particular is what I'm going to focus upon, because I'm in Saudi Arabia and I do understand a lot about the culture out here. Now, as you know, Saudi Arabia is one of the largest countries in the Middle East, and it has enormous oil reserves and has a lot of land area as well. So with oil comes a lot of wealth, and that has put Saudi Arabia into an era of socio-economic transition. So that benefit has, of course, made a lot to the economy of Saudi Arabia, and they have basically uh, given a lot of focus to healthcare. So with healthcare, they have, the primary focus is healthcare, because if health is taken care of in any country, definitely any part of any part of the society would definitely improve. So that's why they give a lot of importance to healthcare. In 2019, Saudi Arabia ranked at 26th position among 191 countries on basis of the healthcare. So that itself shows that how important Saudi Arabia treats healthcare as. So see, in Saudi Arabia, as like any other country, the healthcare sector is divided into two parts. We can say one is the ministry, that is the Ministry of Health, the government sectors, and we have the private organization. The ministry consists of almost 60% of the healthcare being provided, and the remaining 40% are those primary, the small clinics and the private health centers that we have everywhere. Now, in ministry, they have the primary healthcare facilities that's way back in India or Pakistan or any other country that we have, which is there in each and every nook and corner of the town, villages. They have a primary healthcare facility that's very well equipped as well, and they have got secondary and tertiary kind of hospitals or healthcare facilities in the major regions. Not I'm saying villages, but in towns. Not only the major cities, but in every town has a beautifully set up ministry hospitals which cater to each and the whole population out here. So basically, the Saudi Arabia has really revamped the healthcare sector and has brought in a lot of change, which definitely is providing as is a good sign for all those people who are looking forward to come to Saudi Arabia to work, because it has opened a big gap for all of us to, for people to come in. So that doesn't mean only nurses. I'm talking about nurses, be it the paramedics, be it the admin, anyone who's looking into healthcare currently. Saudi Arabia is a place to be, because as I said, of the economy that is very strong, and the recent economic changes, the recent changes in the cultures and everything, and in the belief system, and everything is changing a lot. So that's definitely Saudi is a place to be in the near future. So moving on, let's move to the next slide, and let's focus on how being culturally sensitive is important in healthcare. As I said previously, the Kingdom of Saudi Arabia has achieved a lot of rapid growth recently. So that has led to an influx of many foreign national nurses. Like they have, if you look out over here, yes, there are Saudi nurses as well, but a majority of them are Indians, Pakistanis, Sudanese, Filipinos. So that increasing trend of foreign professional nurses into KSA has got serious implications on their cultural, language, and communication barriers, because as you know, our cultures are quite different, and that is really causing a bit of a hindrance in the service out here. So KSA, as you know, KSA means Kingdom of Saudi Arabia, is a conservative Islamic country, and it is being guided by strict religious beliefs. So if the foreign nurses or the foreign foreign healthcare workforce is not sensitive to understand the Saudi patients, it will definitely impact the service that we give them. I know the way of communication would really bring a lot of hindrance to it, and thus affect our service. So the reason, what I want to say is, cultural sensitivity is very important in healthcare, because gone are those days when we used to just treat the patient with only for the diagnosis or something, but we need to understand the patient. Why is this patient behaving in a manner? What is the cause of this patient? How can the patient be comfortable so that the patient can open up to whatever he wants to talk? There is no barriers between you guys. So see, in today's healthcare, creating an environment of an openness and respect for every individual is very important. By doing so, see, I'll just give you some examples of some culturally sensitive practices that would include, talking in the patient's native language. That would be something good. Offering culturally appropriate, food choices. Like, for example, of course, if you know that predominantly Saudi Arabians are meat lovers, I'm not saying all, but most of them. So, try to, making sure that they are giving when they are admitted in a hospital, where they are in a facility, providing them something which is suitable according to their taste and as per their food choices, would definitely make them feel more comfortable and more valued. And, engaging the family members, using traditional remedies. See, I will talk about this furthermore, but the reason why I'm saying that cultural sensitivity is very important in healthcare, because, as I said, only focusing on treating the patient is not important. You need to focus on treating the patient for his well-being, for his understanding, and making sure that he is comfortable being treated by, he or she is being comfortable treated by you. Now, why is culture and society cultural sensitivity important in Saudi Arabia's diverse society? As I said previously, the expatriate community in Saudi Arabia is very high, but that also means that Saudi Arabians are very much dependent on us for any kind of healthcare jobs currently. So the thing is, we need to make sure that they are comfortable with us. See, if you look into one of the, what do you call, extremely sorry. One of the recent surveys that was taken on one of the hospitals in Riyadh. Almost 300 patients were interviewed for the feedback about how they liked the service in the hospitals and everything, in the ministry hospitals I'm talking about, where the healthcare workforce is predominantly expat communities. So they were interviewed, and they had, most of them were like, the nurses were quite bad, they were not communicating properly, and they were not very happy with the service. So that itself was not because the nurses are bad, it's not because the nurses did not know how to do the job. They said the nurses did not communicate properly. That was because of the cultural sensitivity not shown by our nurses who were treating them. They were not respected. They were not given a thought as to how to communicate well to the patient. The patient did not understand what you were doing. So that's what the patient felt, that it's not important, that they were not giving us any kind of importance. So that was something that really affects that. So that basically, being culture sensitive is very, very important, so that you can definitely make sure that everything is taken care of. Now, moving on to the next slide, let's look into the challenges in providing culturally sensitive care. Now, see, the first and foremost thing is language barrier. Now, language is something that is used for communication, as we all know. It is the basic form of communication anywhere. And in healthcare, when you're treating your patients, communication is something that is very, very much required, because without communicating properly, if the patient is not able to communicate to you properly, if you are unable to communicate to the patient properly, that would really lead to disastrous things. Now, for example, see, a lot of the workforce that I see out here, because we have nurses out here, they are not very fluent in Arabic. Okay, they do try to speak broken Arabic, but that can sometimes be disastrous, because half knowledge of anything can really lead to a lot of errors, and that is something we cannot afford in healthcare. So, because as you know, healthcare is all about treating patients. At the end, it's about humans. We are not dealing with any kind of machines or any kind of soft products. It's all about human beings. So there is no room for any kind of error that can ever happen in healthcare. So language barrier really causes a lot of issues. Now, for example, we do face this kind of issues, that patients do come. Okay, we have patients who come into the hospital, and they want a particular doctor. Like, forget about about Saudis itself. Bangladeshi patient comes and he's like, I want a Bengali doctor. So that's that language barrier, because what he feels is he will not be able to communicate properly to an Arab doctor with his diagnosis. So we have what you call interpreters and everything as such. So language barrier is something that really stops what you call providing any healthcare uh, worker from providing culturally sensitive care to the patient. And secondly, there's the religious beliefs and practices. See, as you know, Saudi Arabia is predominantly a Muslim country, which follows Islam in a very adheres to the principles of Islam on a very strict basis. See, we all do have our own religions, and our own religions have their own what do you call rules, regulations, and set of rules is what I could say. Okay, but what happens is that Saudi Arabia is a country which strictly adheres to them. It's not just because that I know we do have our set of rules, but we sometimes tend to ignore it. We just live our life like as per the normal norms and everything. But no, Saudi Arabia is not a country which does that. They are very much into their religion, and they very much believe in following whatever is the teachings of the Prophet. So we must learn to respect that. Unless we do not learn to respect that, that will really cause a lot of issues. Now, like for example, I'll just give a small thing. In Islam, it's not allowed. It's basically not permitted for a female to be with a male without her spouse or her relative or another female being in the same room. So that sometimes causes challenges to our healthcare, our doctors, our nurses. So then we need to call for example, if there's a male doctor and a female patient, we need to find a female doctor, or we need to find a female nurse to be along with them. But sometimes with the acute shortage of staff, sometimes because healthcare industry is growing and there is an acute need of healthcare workers. So sometimes with a shortage that is currently going on in the GCC and worldwide, it becomes really difficult for us to manage. But that's not something, just because we are having shortage of it, that doesn't mean that we are not supposed to respect the feelings of the patient. The patient is not comfortable being with a man alone in her room. And that is a religious belief. She's feeling uncomfortable, and it's our duty that we make sure that she's feeling safe, feeling comfortable, and she's feeling secure in wherever she is. So religious belief sometimes does cause a hindrance to our what you call to our doctors and our nurses as well. And then comes the next point, that would be culture sensitivity. Now, like for example, as I said, now see, Saudi Arabia is one of the complaints that normally my nurses, or I can talk to our doctors and everything, is that Saudi Arabia is a very the Arab culture completely is very much family oriented. So they do not what do you call is very family oriented. So they do not normally, like in the West or in India or something, the if a patient is having a diagnosis, it's the patient decides as to what his next treatment is going to be. He's like, if he can refuse it, he can accept it, that's fine. But in Saudi Arabia, in Arab culture, it's not that way. The whole family will be sitting together. They are very much family oriented. They sit, they discuss as to what is going to happen. There'll be an elder person who will decide. It's not only the patient who decides it. So that is sometimes, like for example, when you go to treat a patient or you go to meet a patient, there'll always be a bystander. Definitely there'll be a bystander who will be with the patient. They never leave them. So that is something that's very, very important. We need to understand that. Sometimes, yes, as a healthcare worker, we may need privacy. We may not feel comfortable being with another person in the room, but we need to understand it's not about us, it's about the patient out over there. So we need to accept it and get to it. And also about gender sensitivity, as I said previously, as I give the example, we need to understand that certain people are not comfortable being treated with the member of an opposite sex, and that is something that really causes a lot of challenge. So these are the challenges that are usually faced in this region, and these are not something that cannot be overcome. So these are all things that can easily be overcome, and we can definitely look forward to it. So moving on to the next slide, we will look into what are the things that we can do to uh, overcome our challenges. Now, first and foremost is training and education of healthcare professionals. Now, see, previously, all healthcare, the doctors and nurses, whoever used to get a job, maybe in India or Philippines, they get an offer letter. The recruitment company gets you a job in Saudi or in any Arab country. You just pack your bags and just leave off. That's it. You come here, you have no idea how the country is. You have no idea which place you're going to be, what type of people are going to work with you. You have no idea. You just come and then you struggle. That used to happen previously. You must have heard a lot of stories about that. Since if you talk to your people, not only in the healthcare workers, but anyone in the GCC or any other countries. So what recruitment agencies or hospitals who are recruiting people from other countries, from the expat community, they need to, like Medfin. Now, what Medfin is doing currently, making sure that the people who are trying to, the workforce who's trying to come into Saudi Arabia understands what Saudi Arabia is all about. That's why I'm here talking to you today. So training and education of all healthcare professionals is very, very important. And that's something I feel that everyone needs to imbibe that culture, so that the professional who is coming to Saudi Arabia does not feel very lost or uncomfortable over here. Because as I said, see, another thing, we cannot only depend upon the recruitment firms as well. Now, see, you know that I'm going to Saudi Arabia. If I'm in India, for example, and I'm moving to Saudi Arabia, I uh, I need to understand that Saudi Arabia is an Islamic country. They speak Arabic predominantly, and I'm going to be in an area where it's going to be Arabs most. So what I could do is during the recruitment period. Sorry, during the recruitment period, I could just move on to what you call take some course about Arabic, learn about the culture, learn Arabic. So that would make my life more easier when coming to Saudi Arabia. So training and education for everyone, that includes we ourselves or even the institution providing, is something that's more important. Also, sometimes the healthcare institution where you're working, if they keep on providing you different courses, that would be something really helpful to all of us. Then understanding and respecting the religious practices. See, as I said previously, every even in our home countries, every region has their own beliefs. Not to forget the country, I'm talking about every region. For example, maybe talking about the major workforce, Kerala in India. Kerala, you can talk about, see, every region in Kerala. For example, North Malabar will have a different kind of a set of beliefs. The way they practice, the way they treat their loved ones is different compared to maybe the ones in the south of Kerala. So every region is different. So whenever you try to communicate to any patient, when you're treating them in the GCC, try to speak to them, communicate with them, and understand. Now, for example, a patient is like she's like, no, I just want meat, or I want halal food, nothing else, and she's very adamant about it. I'm just giving an example, okay? So it's, instead of being defensive about it, instead of trying to like, no, we don't have halal food, no, understand why, what is the reason. No, you can talk to the patient, communicate with the patient, understand as to why he or she is being adamant about having some kind of some kind of treatment or something. Is there some religious belief related to it? Is there any kind of cultural understanding in it, so that you can understand it? See, a lot of things, many a times, okay, whenever you face a kind of problem or a situation, we're just trying to go into defensive mode and do not use any kind of empathy, or do not try to talk or understand why is that issue happening. The moment you understand why the issue happens, that would really help you out, really try to sober you down and make you understand as to why it's helpful. So understanding and respecting religious practices of your people that you are treating is very, very important, because we are in their country. We need to understand that, and we need to respect their religious practices, and do not ridicule them, or do not have any negative approach towards it at all. And as you said, the third one would be interpreter services and multilingual staff. Now, for example, as I said, have staffs, like, for example, now the place where I'm working, Jeddah, for example, is predominantly Arabs, Egyptians, Arabs, a lot of Indians, Pakistanis, Bangladeshis. So having staff that are from all these regions would definitely help. I mean, now, for example, we have Arab doctors, we have got Indian doctors, we have got Bangladeshi doctors, we've got Pakistani doctors. So, whenever a patient comes, whenever he has a choice, he has to make a choice. He has a variety of options. So, having a multilingual staff is always going to help. And of course, you can have interpreter services, but that sometimes tends to be a bit of a challenge, because sometimes, like, we have to, they may be busy with some other doctors. They can be off, so that will compromise our service. So, always having multilingual staff is something that would really, really help us out. So I just hope you've got an idea of how Saudi Arabia is, and how, what you call, uh, how Saudi Arabia is, how the culture over here is all about. So as I said, in Abeer, moving on to the next slide, like in Abeer, now I'll just give you a small example of Abeer Medical Group. How are we following cultural sensitivity? As I said, we have different nationalities working with us. We have made sure that none of us, none of the patients ever entering over here feel dissatisfied that they are not being treated by a person of someone who knows their language, who can communicate well to them. So that is one of the best things that we have in Alabi, that we have a wonderful set of people working with us from all nationalities. That includes Sudanis, Pakistanis, Bangladeshis, Indians, Filipinos, and everyone as such. So that really is very, very important. And we also do have, we also do conduct training classes for all our nurses out here in periodical things for languages. We have Arabic classes that happen over here every week, almost 2 days. So basically, even the expat community learns the regional language, and we make sure that everyone is trained well, to make sure that we provide the best care to our patients who ever come over here. Because as I said, it's not all about just treating a patient anymore. It's all about making sure that the patient is more comfortable. He will talk to you properly. He will understand. He will feel that you are understanding him, and making sure him or her, and making sure that he is treated very, very well. Now, so that's what it's all about today. I just want to give you some brief idea as to see the five major cultural characteristics about any kind of a culture is the language that they speak. Okay, if you learn the language, nothing better than that. Second would be the traditions that they follow. Okay, second could be said, could be the religion, understanding the religion, understanding why they believe in that religion, what is the basic funda of the religion, would really help you a lot. Second thing would be traditions. Now, even though some people are religious, they have different traditions in different areas. So whichever area you're located in, try to understand what traditions they follow over there. So for example, maybe in the southern region of Saudi Arabia might be a bit more conservative compared to the eastern side. So understand the traditions. That would really help you a lot. And the governance, the country, what is the governance all about? How the country is ruled? What are the what are the beliefs? What are the rules and regulations? That would really determine the cultural characteristics of a country. And lastly, the economy. How strong is the economy of the country is something that would really affect your cultural sensitivity. Because if the country is ready to invest on foreign nationals, in training the foreign nationals, in making sure that everything is provided well for the country, and a country like Saudi Arabia is into it, so that is something that is really important. So Saudi Arabia is definitely a country which you can look forward to. It is bringing a lot of change out over here. There is a lot of progress happening currently out here. And what do you call, and they are really welcoming the healthcare workforce, and they are looking forward for uh, serving as well if we are ready to serve them well. So if you're looking for Saudi Arabia, definitely it is one of the best places to be currently, and it has a lot of growth over here. So inshallah, if you all are looking forward, please do visit Saudi Arabia and work over here. And I would that's all for today. And for that, I would really like to thank Medfin for actually giving us this opportunity and being uh, really kind enough. So and bringing out a change in the society, and the way how recruitment works, and by allowing such kind of training sessions and webinars, so that the workforce out there understands as to how a particular country is and what all they need to be prepared when they come over to a new country, which unfortunately our ancestors or the people before us never went through. So that's all for today. Thanks a lot, and thanks, and have a nice day.